Well, hello and welcome to Ask the Professionals Q&A. My name is Heidi Sittelmeyer, and I am the Director of Online and Community Connections here at the Arthritis Foundation. I facilitate a Live Yes Connect group here in Los Angeles, and I am a patient living with rheumatoid arthritis for well over 50 years and also have osteoarthritis. Ask the Professionals Q&A is an interactive video series where we solicit questions from the arthritis patient community and then bring them to leading experts to help get our questions answered. So today I'm thrilled to have Gary Solomon with us for Ask the Occupational Therapist. Gary is the Director of Therapy at Chicago Metro Hand Therapy. He is currently the Vice Chairman of the American Hand Therapy Foundation and an affiliate board member of the American Association of Hand Surgery. So welcome, Gary. We're so excited to have you.
Thank you very much.
All right, so let's go ahead and dive in because I know a lot of the questions that we got from our patient community around occupational therapy covered a wide and far, shall we say. So the first question that I'd like to give you today is, what credentials should I look for in an occupational therapist?
Sure. Kind of depends on what your problem is. My specialty areas is I'm what's called an occupational therapist and a certified hand therapist. So my specialty is hand, wrist, elbow, and shoulder. If you have one of those areas, which is your primary problem, hands, wrist, elbow, or shoulder, I recommend someone having the credential of what's called a certified hand therapist or a CHT. That ensures that they have at least 4,000 hours of practice before they can even sit for the examination after graduation. So after they become an occupational therapist, physical therapists can also become certified hand therapists as well. But whoever you're seeing, if they have the CHT credential, you know that they've had additional hours and passed a specific exam on hand, wrist, elbow, and shoulder. So their primary area of practice is going to be in the area of your ailment.
Great. I was trying to do the mental math of what 4,000 hours is. That's
the minimum is 3 years. Most people are about 3 to 5 years, depending on whether they're working full-time or part-time.
Wow, that's awesome. And that's commitment. So the next question we have is, can I do a telehealth OT appointment, or is it most effective in person?
Probably most effective in person, especially for your first visit. There's a lot you can't see in the two-dimensional screen, having done both some telehealth over the past year and a half and live. It's a good, if you have just simple questions, telehealth can definitely be advantageous. And for follow-ups, sometimes if you just have simple questions or want to go over the exercises that the therapist gave you, especially if you have transportation issues, then telehealth can be very beneficial. But if the first appointment, if you can get in there, things should be measured, things can be looked at, how you have to feel as a therapist, how muscles are functioning, what's weaker, what's stronger. And that gets a little bit tricky on telehealth appointments.
Okay, yeah, and that totally makes sense. So the next question is, does insurance cover in-home OT?
In-home occupational therapy is covered usually if the person really has home confinement. So they're usually eligible for other home services as well, like visiting nurses, home PT. Then usually the home OT is covered if prescribed by the physician. Once somebody is deemed able to ambulate, basically get out of the house, attend other appointments, then typically insurance will not cover the home visit as much unless there's a specific question relative to safety in the home, in which case a home evaluation can be done regarding safety and equipment in the home, accessibility in and out of the shower and on the toilet, and other environmental barriers in the home. So then it would be covered if a specific home evaluation is covered, but just general therapy sessions in the home, most likely not if you're ambulatory and can go out of the house.
And the next question we have from our community is, what should I expect at my first session with an occupational therapist? And can I prepare so I get the most out of it?
Absolutely. Best patients always come in sort of prepared, understanding what their needs are, what brought them in. So ways to prepare, and I'll start with that one because I think that's the most important part of the question, is understanding how whatever impairment you have is impacting your daily life. So what are the things that are the most troublesome for you to do, or the most difficult for you to do, and what would success look like? What would a successful outcome look like to you? What's your goal, as we like to say? What's your goal for therapy? Is it to open jars easier? Is it to get rid of pain when you're sleeping? Is it to get stronger? Is that you have stiffness and motion loss and want to resolve that for various reasons? But if you come in with a good functional goal, then the therapist can really work with you to sort of get you to where you want to be. So that's really how you can prepare, is really have a good understanding also of your symptoms. When does it hurt? How does it hurt? What time it hurts? What kind of things make you feel better? What kind of things make you feel worse? So a good idea of your symptoms and how they impact you. As far as what to expect, one is a good interview, a good conversation initially about what's been going on and how that's impacting your life. And then, so on the more technical side, you'll be asked to do a lot of different motions based around the joint or joints which are bothering you. So the measurements will be taken, and that's how one of the ways we objectively track your progress. So there's two ways that we look. That the patient, number one is, and you may get a questionnaire too about how things are impacting your life. We want to see that the subjective, how you're feeling is improving, as well as some of the objective measures that we look for, whether it's improved motion, improved strength, improved mobility, etc. And then before you leave that first session, you should expect to leave with a home program. You should always have a home program. If you don't get a home program, then just ask for it, because your hour with a therapist once or twice a week for however long your prescription is nothing compared to the amount of time where, there's all the other time which you need to be working to get better. So our goal is to guide you and teach you and aid you, and then the patient job becomes to practice the skills, give feedback on the program we give, and then at the next visit kind of go check back in, see how things are doing, hopefully upgrade.
Awesome. And tied to it, a similar question, or in the same family, is how many sessions will I need to do and how often before I start getting results?
Sure. The number of sessions and frequency and duration is totally dependent. Let's say I see a lot of people who have the base of the thumb joint replacements. That's going to be 2 to 3 times a week for about 6 to 8 weeks because you're recovering from a surgery or procedure. Other people who come in more because things are acting up, are more painful than they were a month ago. Sometimes that's for me to make them a splint or an orthotic device to help with the pain, as well as teach them some home exercises. Then visits would be less frequent. Maybe I do that for them and check back in a week or a week and a half to 2 weeks to see how they're doing. So those would be less frequent. As far as how long to expect results, if you have something that you're going regularly for, so if your doctor's prescribing, whether it's increased pain, which is more recent, that they want you to go a couple times a week for 4 weeks. At the end of that 3 to 4 week period, you should be seeing some progress towards the goals that you and your therapist established. If you're not, you should be done, and you should check back in with your doctor. And then if you're feeling better before that time, there's no reason to continue. So it's sort of based on, you don't have to go for 8 weeks just because the physician wrote 8 weeks on the prescription. But if you're improving, usually if you're some improvement, but it's not quite where you want to be, but it's steadily progressing, then the physician and the therapist and you may want to extend out. But it's good to check back in every 3 to 4 weeks with the physician and with therapist, reevaluate sort of, here's where we were, here's where we are, and if we're on the right path or not.
Great, thank you. So our next question is OT just about hands? I'm having problems with my shoulders. Should I see a PT instead?
So for certified hand therapists, it's the specialty area, just like for hand surgeons. The name is a little outdated. Most hand centers are called hand to shoulder centers now. So the area of specialty is hand, wrist, elbow, and shoulder. And again, the CHT specialty covers both occupational therapists and physical therapists. But it's nice to see whether they're an occupational or a physical therapist. If it's a shoulder problem, just because it's in their area of expertise, they're not also focusing on backs and feet. So that's what I love about the specialties. It's just you're a little more focused on those areas.
Great. And can you offer some shoulder exercises to help relieve tension?
Yeah, it's a sort of a very generic thing. It sort of depends what the issue is. If you're having general shoulder and stiffness and tension, and a lot of us do things sort of in front of us all the time, I always like to even if you set a little timer back, if you're at a computer for a long time, every 45 minutes or an hour, just work on squeezing your shoulder blades back, because everything in our life is forward, right? Pinch, and you can see a lot of people, their shoulders start to set. So work on shoulder squeezes. If you're having shoulder stiffness, just sliding a towel up and down a wall a little bit, just to sort of stretch yourself out is good. And then if just to either work on kind of just reaching behind your head a little and behind your back a little, just making sure that everything, you're moving in all the directions. But especially if you're seated for a long period of time, really making sure you're getting those shoulders back. I mean, you're not shrugging a lot. So down and back is usually a good way to sort of work them out a little bit.
Well, that little bit that I just did right now helped, because I was feeling definitely a little stiff today. So the next question we have is, I have difficulty holding and grasping things. What are some ways I can strengthen my hands?
Sure. And it depends if the problem really is a weakness problem or is it an arthritic problem that it's causing pain in the joints. The biggest thing that with arthritis is that you don't want to force it necessarily. You don't want to force strengthening. There are ways to strengthen hands. Sometimes the therapist will give you something gentle to squeeze, but I don't recommend a ton of repetitive squeezing. It's not natural and it tends to cause more inflammation. I like for people who have trouble holding specific objects to try it and grade it. So if you're having trouble holding a full cup of water, work on half a cup of water for a while and practice moving that around, and then go a little more and a little more. If you're having trouble lifting a grocery bag, better to have a lighter bag. And again, you can work on more what I call functional strengthening, stuff that mimics the problem that you're having difficulty with. I don't recommend squeezing a ball, which is what a lot of people do. Again, that's a great way to get tendonitis in your hand, and it tends to just cause more problems than it solves, because hands, the weakness that people feel, it's more because of the pain and the damage in the joints rather than true muscle weakness. So functional strengthening. The other thing I always recommend when people complain of hand weakness, get themselves closer, use their whole body and their shoulders a little bit more to do the motions. Don't do things out in space so much. So you're depending on larger muscle groups rather than the small muscle groups in the hand.
Great, thank you. Next question is, how can I make my office joint friendly? For example, how can I prevent aggravating my wrists and fingers when working on a keyboard and using a mouse?
Sure. Common question, and the good thing is keyboards aren't usually the most aggravating factors. Mouses sometimes are. The thing that you need to do is understand where your setup is. Things should not be far away from you. You should be able to have your wrists straight or wrist neutral when you're working. So you shouldn't be tilted in or tilted out when you're working. The mouse should be in a good position. Not every mouse is the same too. So if you don't like the one you have, if you feel the tension is too hard and you're getting pain in your thumb, you can try something with a lighter touch or with an index, an index button that does something. But make sure that things are fairly close and that everything is sort of within a reach for you, that you don't have to extend out too much. So things should be nice and close in. You should feel relaxed. Your shoulders should be relaxed, your wrist should be neutral, and your hand should be sort of in a nice straight neutral position, not tilted in or tilted really out when you're working on your keyboard. Unfortunately, as keyboards often come in one size, it fits all. Humans do not. So you have to sort of look at, if you're looking for an office environment, it's a little bit different for every single person. So you have to have some variability for chair height, desk height, and workstation heights as well.
Okay, great. Yeah, because I know I actually have to adjust my chair because so that I am in neutral. So, all right, great. Next question is, what are some things I can do at home to help with hand pain? And when is it time to see an occupational therapist for my hand pain?
Sure. Can you repeat the first part one more time? I got.
Absolutely. So what are some things I can do at home to help with hand pain?
Okay. And again, hand pain, it's a very generalized thing. If you have an idea of what's bringing it on, then it's a little bit easier to work with. If it's generalized hand pain, um, when to see a therapist is really when it's starting to interfere with the things that you like to do in life. Sometimes that's, heavier stuff such as gardening, and people will come in and see us because they're having trouble with heavier activities. And sometimes it's as light as buttoning and cooking. So if it's interfering with life, things that you need to do or things that make you happy in your life, then it's not a bad time to seek help. Rather than wait till it gets debilitating. Sometimes we'll provide you a simple brace or some advice on a simple tool to make those overcome those obstacles for you, as far as opening things and fastening things that can make it easier. If you do something that you just know that you overdid it, that's a good time to immediately apply cold. People ask me about when do I do cold and when do I do hot a lot. So if you just did something and I was digging weeds, maybe throw a cold pack on it for about 10 minutes after you did that, because that'll help decrease the inflammatory response to what you did. If your trouble is more, you wake up in the morning and you're feeling stiff, or there's times through the day when your hands just start to ache and feel tight and stiff, that's when warmth tends to do a lot better. Usually about 10 to 15 minutes maximum of just a gentle warmth. It shouldn't be burning hot, but just a nice warm pack, and then to start moving a little bit, keep the joints moving. That's the other thing which helps hand pain a lot. Motion is lotion, right? Things get stiff when they don't move for a while. So just simple going through a full range of motion of whatever joint is bothering you, not to the point of pain, but a comfortable range, can also be quite helpful.
Great. Yeah, I know for myself, I'll definitely do the warm or cold, depending on, what's going on. Also, sometimes just reach into my drawer of splints and braces and grab like a wrist brace if it's not feeling good. The one question I have, though, that I know I saw come up that after we talked about the different questions is, how long can somebody wear a brace? Is it okay to wear it overnight if you
Absolutely. Yeah. Braces are meant to rest a joint which is getting inflamed and causing pain. So it should be made, and it should be comfortable enough to rest the joint in a position where it just feels a lot better. Shouldn't be worn 24/7, but some people have pain at night, in which case it's definitely a good time to wear it. Some people have more specific activity related pain, in which case that's the time to use it. And that's how it should be constructed. The brace should be made to basically be beneficial for the activities which cause you the most discomfort. The other thing they do is just support joints, which are, you can have deterioration of the joints. So the brace it holds the joint basically in better approximation to where it's supposed to be. And that's why sometimes it can be very helpful at night as well, just to relieve that pain and keep the joint, in the correct position.
Perfect. And I also know that I'll toss on a topical sometimes because that'll help make it feel better also. Fantastic. So coming into our last question, how can I get better sleep with joint pain?
Sure. Depends on the specific joint again. So let's start with shoulder. If you are a back sleeper, it's good to have a pillow sort of under here and behind you. So what happens when you fall asleep is during the day, your muscles hold it up. And when you fall asleep, your shoulder kind of falls back, and that can be painful. So if you're a back sleeper, under here, if you're a side sleeper, pillows on the side against your arm doesn't fall down. When you lay down on your side, it can be nice and level, sort of like a body pillow. For wrists and hands, it's a little different. Sometimes people do like a little light wrist brace or a little thumb CMC brace if the pain is over here, just again to position the joint. If not, even if there's a small soft pillow or something that you can rest your hand on, like a little throw pillow. So basically you want to have the hand resting sort of in a comfortable resting position where the thumb's not getting caught up or the wrists aren't getting torqued down. So towel roll, a small towel roll in there can sometimes be very comfortable. At night, it's a little nicer to have something soft, obviously, but that's what you're trying to do, is position things in what we call neutral, comfortable resting position, and to prevent things from falling down or subluxing or getting bent backwards.
So we have another great occupational therapist who's going to give us her perspective on a few additional questions. Jeanine Beasley is a full professor at Grand Valley State University, Occupational Science and Therapy Department, and is the coordinator of the Occupational Therapy Hybrid Program in Grand Rapids, Michigan. Thank you for joining us today.
It's my pleasure. Thank you.
So let's jump right in. I'm going to provide you with more questions from our patient community. So the first question we have is, can you explain the difference between occupational and physical therapy? And how do I know which one I need?
Very good. Well, that's a question that I get quite a bit. Many people understand physical therapy, but occupational therapy, I've been doing this since 1979. And so it seems like whenever I get in an elevator, somebody asks me, what is occupational therapy? I think both physical therapy and occupational therapy have things they address in regards to joints and muscles and the like, but they look through them through a different lens. So physical therapy is going to look at it in terms of functional mobility, gait training, and that type of thing, and also function, but through that lens. Where occupational therapy is going to look at it through self-care, activities of daily living, and also the things that you want and need to do. So, and then I'm also a certified hand therapist, so I look through it through that lens as well. But there's both physical and occupational therapists that are certified hand therapists. So there is overlap, but just as like if you would have maybe a doctor who's an MD and a doctor who's a DO, they're going to treat you for very similar conditions, but look at you through a different lens. I hope that helps.
That does. I know for myself, I always equate it with like working smarter, not harder, right?
Mm.
We protect our joints, and do things that are more joint friendly.
Very good. Oh, yes. I love that you say that, because joint protection is one of my favorite areas to talk about. And there's such wonderful research to support following joint protection principles. So
Thank you. Thank you. So the next question we got from one of our patients is, how do I get my doctor to prescribe OT?
that's great. Well, of course, it depends if you're going to a rheumatologist or to your general doctor. Sometimes there's physicians who are prescribing OT all the time. And so they're like, sure, I've got one right here in my office. That's other times they are not as familiar with OT. So I think it's good to ask your doctor about non-prescription interventions. So what else can I do to help my arthritis? And that's when it's best to say, would you recommend physical and or occupational therapy? Or my goodness, my hands are giving me some issues. Would it be best to see a hand therapist that can do that for me? Often I get the patients when they need some type of an orthosis for their hands. Some kind of splint is what a better name that many people know. And they think, oh, it's time to go to the OT to get a splint, or the hand therapist or the physical therapist. But there's so much more that we can offer that is in the research that can help our clients who have both rheumatoid, osteo, and many other forms of arthritis.
As a longtime patient, I know I have my drawer full of splints and, all my different protective, for when, my joints are not happy, even have a sleeping splint.
Oh, I'm so proud of you. That is great. That is great. And the splint for rheumatoid arthritis, the sleeping splint, has been found to be very effective in research with there's studies that group a bunch of studies together, and that's called a systematic review. And there's been systematic reviews, which is done on rheumatoid arthritis and night splints, and they have found that wearing a splint at night decreases pain and also increases grip strength. And you think, how is that possible? It's just sitting there, but it is because the joints are lined up and work better to do your daily activities. Sorry, I'm in academia, so I get right into that research. Please forgive me.
I find that a lot of us really enjoy the research, and getting it distilled down like you just did is perfect.
Oh, good. That's my goal. So.
Great. And that, that actually really dovetails right into the next question that we have. So what does research show about the effectiveness of OT for long-term, i.e. slowing down OA progression and improving balance to prevent falls?
That is just a great question and a very large question. But for example, let's start with osteoarthritis. And in fact, I have osteoarthritis. And so I've got some great interest into the research in this area. What's amazing is that there's so much research for osteoarthritis, especially the joint at the base of the thumb, which is called the carpometacarpal joint. And if you see a therapist and get information about joint protection and specific exercises called the dynamic stability approach, and then also get an orthosis for your thumb, there's great support for that decreasing pain, increasing pinch strength. And there was one study out of Europe that showed that it actually prolonged, you didn't have to have surgery. 7 out of 10 people that wore that orthosis did not have to have surgery. So the person who asked that wonderful question said, can we slow down osteoarthritis? I think that was the best study that I found. I don't know if we can slow it down. There's not research to support that, but delaying the need or eliminating the need for surgery in 7 out of 10 people, that's pretty cool. So,
that's remarkable. Yes.
Yes. So, and as far as the second part, as far as preventing falls, keep working on your balance exercises, which can vary depending on what the person needs, has really demonstrated in the general population to be very helpful. And we know that if we can avoid a fall, we can avoid a fracture. And if we can avoid a fracture, we can avoid a whole lot of problems down the road. So there is lots of balance exercises available, but under the direction of a therapist would really get you started in the right direction.
Perfect. As somebody who inadvertently fell a couple of years and fracture, I'm very conscious now of the importance of that. And my arrogance that I was like, oh, I'm too young to fall, right?
Oh, it's amazing. It's amazing. Yes. My mother has osteoarthritis as well, and she's 85 years old. And all the smoke detectors, needed new batteries. And I was over there this morning. She says, I can do it. And it's like, it's not worth it. It's not worth the risk of you falling and really injuring yourself. So it's okay to ask for help with certain things so that you can do more. If you fall, now you're going to ask for a whole lot of help.
Yes. Yes. I learned my resistance to asking for help as a result of that. Now I'm very practiced at it. All right, so let's move on to the next question from community in the online community. So what are the most common assistive devices that OTs recommend and why?
So they kind of fall into two areas. The research, of course, here I go again. And by the way, you have a great community. These are fantastic questions. Thank you so much. But there was a study done that where therapists recommended a variety of pieces of adaptive equipment. And they went back many years later and found out which pieces of adaptive equipment they were still using, like 7 years later. And they found that 95% of the tools that were recommended for use in the kitchen were still being used. You could buy a whole closet full of adaptive equipment that you're not using, but you have to be sure that it's something that you're going to use. And this study showed that, especially like an ergonomic knife, the jar openers, the things that we really struggle with, were used many years later. The second area is really being safe in the bathroom. Now, if there's any place in your entire house you don't want to fall, it'd be in the bathroom. And if there's any chair that you want to get in and out of easily, it would be the toilet, because we all must visit that place. So adaptive equipment there can make sure that your toilet is the right height. If it's too low, it's really hard on the knees as far as getting up and getting down. It may be grab bars that are professionally installed, sometimes near the toilet and sometimes in the shower. Walk-in showers are very helpful. It's very difficult, I'm sure, as many of the people that have wrote these wonderful questions, to get in and out of a low tub is just hard on your knees. It's slippery, it's scary. And so either standing to take a shower or using a shower chair in the shower. And these can be lovely. These can be just, if you can actually redo a bathroom so that you have a toilet that's higher and a shower chair that's built in. Or it can be a simple, I think I go to Goodwill all the time, and there is a shower chair there almost every single time I go for like $10. It can be very inexpensive. So those seems to be the areas that make the biggest difference. But I'm sure your followers here have seen a million types of adaptive equipment, and there's so many things. If I could just talk about two more, I'm sorry. Okay, already, two more. With my patients that come into the clinic, they drive to the clinic and they can do everything on that car except two things. One is they have a hard time starting the car, and the other is opening up the gas cap. You say?
Yeah.
Okay, so there are these two pieces of adaptive equipment are that I often recommended, and it can be as simple as just adding a little piece of splinting material or plastic onto the key so that you can turn it, and that's something your occupational therapist can just do very easily. And there's also gas cap turners that you can use to open a gas cap, because many of my clients were waiting for someone to help them at the gas pump. You seem like you've had some experience with this.
It's like, when the hands are really creaky and it's like, okay, I'm going to have to ask somebody. The bottle of water.
Oh, I know, yes.
Sometimes you get a shower.
I know, it's so true. What's interesting is I was talking about this. I got to do some lectures over in Europe, in Germany, and I was talking about gas cap turners, and they looked at me like, what are you talking about? None of the cars in Germany have gas caps. They are automatically built in. So I've decided that we should all go pick it and get rid of gas caps altogether. And so the new cars would be coming out without gas caps and just self-close. But maybe that's silly. I don't know.
Well, yeah, and I know for myself, there's definitely things around dressing. You know, I love my long-handled long-handled shoehorn, and then I do still use my gripper to pick up stuff off the floor. So, you know, when I'm particularly stiff, those all make a difference. So
That's great. Yeah,
Right.
and having the right one. There's a folding reacher that can fit. If your reacher's not with you, your reacher's not really working for you. So, oh, good, okay.
My reacher.
That is great. That is so good. And you can get a very inexpensive one, which is just a dowel rod with a hook on the end, which can do a million things. Or you can get very expensive reachers, but it has to be lightweight, because remember the leverage that you add. Yeah.
Mhm.
So you're going to be limited in what you can. You don't want a heavy reacher and then a heavy thing you're picking up. So consider a therapist can really help you determine the one that's best for you. And we don't get any money for selling you a reacher. You know, we would recommend it and help you pick, order one or whatever. But we're really just in it for your independence as much as possible. So
That's awesome. That's awesome. Well, let's move to the next question, and it's related to kids with arthritis. So for kids with JA, they usually get referred to PT rather than OT. At a young age, is one more important than the other, or is there a big difference for kids?
I love this question. So when with juvenile rheumatoid arthritis, the kids, you really need to focus on development. You have to be sure that they're meeting those developmental milestones as they're dealing with their arthritis. And so that's a focus of both PT and OT. Again, sometimes the rheumatologists are more familiar with PT than OT, but and because there seems to be more concern about mobility. Be sure, how are they walking? And so that's where the PT focus, and that PTs are expert at exercises and different modalities and mobility and gait and getting that all working really well. But then when it comes to the upper extremities or the hands, and looking at, are they able to do buttons, developmentally, tying shoes, feeding, all those skills of self-care are just as important as walking across the playground, because when they get there, they're going to use their upper extremities to do an activity. So I wouldn't see it as an either or. I would kind of see it as a both. And if you're getting an order for PT, but you're really concerned about some of those activities of daily living issues with your child, then I would seek out an occupational therapist who has experience in pediatric arthritis. So I hope that kind of answers the question. So
I think you did a good job. And I'm reminiscing back because I was diagnosed at the age of 8. So I remember definitely going to physical therapy, and I also do fortunately remember working with an occupational therapist at some point in time as well while I was a kiddo. How can I protect my lower back during daily activity?
Well, first of all, I love that you're thinking about it, because so often in our life, we just go and do and move, and then we've hurt our back. And so it's really about good posture. It's about a wide base of support, and to avoid twisting. So if you're moving objects from point A to point B, a wide base of support, I like to think of it as a ballet move, kind of like a gentle plie, you see? And if you watch basketball players play, they're low and down and moving and protecting their spine. But really, it's for when you're moving, it's that wide base of support, and a little flexion in the knees is really helpful. But then when you get to where you're going, standing for long periods of time is really hard on your back. So if you can have one leg up on a chair rail or a little box, that can be so helpful in decreasing the amount of pain and pressure in the lumbar area, which is where a lot of people get that pain. So it's kind of like looking at what you need to do, lifting with your legs and not your back. And then also, once you get there, getting a posture where your spine is aligned and the pressure's off that low back. So
yeah, I know for myself, I have to almost do like this little shifting of the weight back and forth, because then there's also the knees that aren't happy either.
right.
Definitely working on making sure that my spine, I'm, shall I say, stacked nicely.
So important. And that's also important with sleeping as well, getting that nice stack of your spine. So yeah.
So the next question we have from one of our members in our community is, what services are available from an occupational therapist for someone experiencing hearing loss?
Okay, well, I would, of course, I'm sure they're working with an audiologist in regards to this, and they're going to be your experts into maximizing that area. But with arthritis, it may affect the finger and hand joints, and dealing with tiny, that difficulty in applying a hearing aid, adjusting a hearing aid, changing a battery in that, that's small, tiny little stuff. And so sometimes an occupational therapist can help you to identify ways that can make those activities work better for you, which is really kind of important. Also, looking at it in regards to how you can get a system that will allow you to function in the community. Like there are theaters that can loop into your hearing, in your hearing systems. And it's usually, sometimes surprising, churches will have the loop available. So it's like, these are the activities in my life that I really want to do. I really want to hear them. I've got my hearing aids, but I got to plug in. I got to figure out how to plug into those things. So that's just one way that occupational therapy is going to look at your hearing loss through that lens of occupational therapy and how is it affecting your function.
I love that. I'm hearing, no pun intended, that occupational therapists are like our solution finders, right?
Oh, we try. We really try.
Let it go. Is there a solution or a workaround? So that's awesome. That's awesome.
Yes. Yes.
Our next question, actually, you touched on a little bit. How can I get better sleep with joint pain and like hip pain?
Okay. Well, first of all, you don't really want to stay in one position with arthritis, as you know. Oh my goodness, we all know that if we got to be moving around. Yep. And taking breaks. But when you're trying to get a good night's sleep, that means, how am I going to be stacking up my spine when I'm on my back, and how am I going to do the same thing when I'm on my side? Okay, so at least going between those 2 to 3, if you go to the other side, sleeping positions. Yes. Oh, I love it. And so that really can affect. Let's start with the pillow. So the pillow when you're on your back should be pretty thin. You don't want the head way forward, and you don't want no pillow, you see. And so that may be a different thickness of pillow than it would be when you're on your side. So maybe you need a pillow or 2 different pillows, or a pillow that folds so that you can readjust it as you go to your side. Then let's look at the upper extremities and lower extremities, or the arms and legs. So on your back, you want to have that lined up. A lot of people put a foam roller under their knees for a little hip and knee flexion when they're on their back. But then when you're on your side, getting a pillow between your arms and between your legs can be really helpful as well. So it's like, you got to be set up at night to make those changes. So you're not, I got to get up that pillow, which is way over there. So, and then you lose some of that deep sleep. Also think of it's called sleep hygiene, which means having, no screens, no computers, no TV running. Also, I like to have a nice thread count in my sheets, and also pajamas that allow you to move around. So flannel on flannel sheets is going to be a lot of work for you to get from point A to point B. I sleep with a pillow that's a satin pillowcase that allows me to move very easily, and also pajamas that are a little bit slippery, you know what I mean, that don't provide a lot of resistance. And so those are ways that I have found to be very helpful for people to get a good night's sleep.
Terrific, thank you. Yeah, I can definitely relate. I made that mistake one time with the flannel, and it's like, oh, this is not gonna I am one that moves, and I do have like my knee pillow on my bed. So when I roll to my side, I just pop it.
I love it. You're like, we haven't even talked. This is amazing.
All right, so the next question I have, and it actually is our final question. Any tips to help relieve sciatic nerve pain?
Well, as I would just immediately send you to one of my very good friends, a physical therapist who can address this issue. I do believe that the tips we already gave on posture and standing and avoiding twisting and all of that can be helpful. But my expertise is in the upper extremity and in the hand. So when I see someone who says, well, it's my sciatica, I say, hey, let's send you to the very best person there. And so if you're seeing one therapist for one thing, they can usually recommend a fabulous therapist, like a physical therapist for sciatica or whatever you might be needing. So once you're in the loop, boy, I've received so many referrals and so much information from other clients. So don't underestimate the power of networking with other people with arthritis and with your therapist that you work with.
Absolutely. Well, your answers have been spot on. Thank you so much. Any final thoughts you want to share with our community before we wrap up?
No, I just think it's great. Arthritis we don't have a cure for arthritis. So it's a lifelong thing. The medications, of course, have helped tremendously, but they haven't made arthritis go away. So if you can have a lifelong attitude, which involves networking with other people, just as you did here with the Arthritis Foundation, and also seeking out the best people who are therapists and physicians to help you, you'll really have the best outcome possible for managing arthritis.
All right, perfect. Well, thank you so much. It was absolutely a delight to have you with us today. Great, awesome. Well, thank you, Gary. I really want to thank you for your willingness to come on and tackle these questions with us. We really appreciate you spending the time educating our patient community and providing us with really some sound advice.
My pleasure. Wonderful to be here.
Great. So, are you curious about what we'll be tackling next month?
Absolutely.
Great. So, I really invite everybody who watches this to visit the Live Yes online community at https://liveyes.arthritis.org on August 1st, and we'll reveal the next topic in the Ask the Professionals Q&A. And to learn more about the Arthritis Foundation and our awesome programs and services that we provide our community, please visit arthritis.org. We have all sorts of patient education webinars, which I know Gary has participated in before. We have podcasts. We have our Connect groups, which are meeting virtually. And we, of course, have the online community and our Insights program, as well as our brand new Vim app. If you haven't checked out the app, please check it out. It's a great new resource for our community. So thank you so much for your time again, Gary, and we'll see you guys next month.
Thank you.